Yeah, sir. Start.
Okay.
Yeah, sir. Start.
A very good evening, one and all. I cordially welcome you all to the online postgraduate lecture series on Prasooti Tantra and Stree Roga for the postgraduate scholars. Today's session is a vyadi which we generally come across. So in few classes, few other sessions, we had dealt with the basic concepts, etc. So today's concept would be a starting of a particular disease. So Rajiv Gandhi Ayurvedic Medical College, that is Rohan, Karnataka, also with Jignasa, Karnataka, jointly presents Jnana Jignasa. And we have our guests for today. Our guest is Dr. Vandhana S Kulkarni. So Madam is professor and head of the postgraduate department of Shri J Ayurvedic Medical College, Ghataprabha. In fact, it is a great pleasure for me, a double pleasure for me today. One is being your host, and the other one is to be with my postgraduate guide, that is my madam. So I welcome you, ma'am, on today's for today's session. The screen is yours now, madam.
Thank you, Chess, for my good introduction. Good evening, everybody. Good evening, my beloved student. First, I thankful to Dr. Pottul Shetty sir, Principal, Rajiv Gandhi Education Society, Ayurvedic Medical College, Road, and other sponsors also for giving me this wonderful opportunity to express my views about Garbhini Chardi or vomiting of pregnancy in this online webinar and guest series. Next, very important, I want to express my special thanks to my beloved student, still student, Dr. Shreyas, who is the reader in Prasooti Tantra and Stree Roga department, Rajiv Gandhi Education Society's Ayurvedic Medical College, Road. Really, Shreyas has passed 6 years back. Now he is working as a reader, but his behavior with me is still as a PG student. So I feel very proud about Shreyas. I am very lucky to have a student like Shreyas. Okay. Can I? Shreyas, now can I stop slide sharing?
You can start, madam, but turn on your video also, ma'am, please.
Video is on.
Okay, okay, madam. Yes,
See,
you can
my
go if
video
it is
is
on.
not.
Yeah, you can start, madam. You can start. Continue, madam.
Video is on. I should see, please. Okay. So this guest series is for PG students, exclusively for PG students, PG scholars of Prasooti Tantra and Stree Roga, definitely. And next, in our state, our PG students are going to face the examination. First year PG students also and final year PG students also. They are going to face their examinations in coming September. So keeping these 2 points in the mind, I am going to speak about this very versatile topic from our Prasooti Tantra, that is Gharbhini Chardi or pregnancy vomiting. Okay, so coming to the next slide, Gharbhini Chardi. Which points I like to highlight, I'm going to highlight today or tell you today. First is we should see or we should study the Gharbhini Chardi according to Ayurveda, because just I told you this lecture series is exclusively for PG students. And next point, our PG students, first year PG students, just they have submitted their synopsis. Final year PG students, they have submitted their dissertations, and 3-4 months are remaining for their theory and viva examination. So now they are concentrating on their preparation for viva and theory examination. So from that angle, today I like to highlight some points related with this Gharbhini Chardi or pregnancy vomiting. So we should study Gharbhini Chardi first according to Ayurveda, next pregnancy vomiting according to modern sciences, and next we should think about practical application of this Gharbhini Chardi or pregnancy vomiting. Sorry. So first, coming to the first point, that is Gharbhini Chardi according to Ayurveda. If we go through our Ayurvedic classics, we see that there is no any chapter on Gharbhini Chardi is described in our classics. So there is no any description for this Gharbhini Chardi in our Ayurvedic classics. Then how to study this Gharbhini Chardi? For that, we have good reference from Kashyapa Samhita, our Kashyapacharya, great Acharya. He told that all diseases occurring to non-pregnant lady or to any other human being, normal human being, may occur to this pregnant lady or this Gharbhini during Gharbhini Avastha. And he next told that description of that disease we should take from the description of that disease as general. So Gharbhini Chardi, for this we should take references from Gharbhini Chardi described in general. Okay, because what he told is, because he told that dosha involving in that disease and symptomatology also is same in Gharbhini disease and disease occurring in non-pregnant state or occurring to the normal human being. Okay. Next, coming to the treatment, but he told don't follow same treatment which you are advising for the normal human being or for the non-pregnant state. Why? Because this is the Garbhini Avastha, very delicate Avastha. This Garbhini Avastha is compared with the Taila Purna Patra. Taila Purna Patra. If we want to move this patra from one place to another place, very delicately, carefully we should carry, because any oscillation or slight disturbance may result in the spilling of that oil from that patra. Same thing here in Gharbhini also. Very carefully we should treat the Gharbhini diseases or Gharbhini during Gharbhini. We should be very careful. Okay, so in this Gharbhini Avastha, when we come to the treatment of disease described in this general, Chikitsa differs because Shodhana Chikitsa is contraindicated in pregnancy. But if we do some changes, we can follow the Shodhana Chikitsa. Next, coming to the Shamana Chikitsa also, Tikshna, Ushna Dravyas. From that Shamana Chikitsa, we should omit. So while using that treatment, we should filter, keeping that in the mind that this is the Garbhini state, very delicate state. Okay. Next, coming to the point, because students are appearing in the September, so theoretical points are very important. After that, I will come to the practical application. So next point, references for Garbhini Chardi from our Ayurvedic classics. Mostly all classics, all our Acharya have described Chardi as a Garbhini Lakshana. In Vyaktagarbha Lakshanani, if you go through the Vyaktagarbha Lakshanani, in that Garbhini Chardi Lakshana is described. If you go through the Charaka Samhita, Charakacharya has also described Chardi as a Vyaktagarbha Lakshana, and he has included under the Dvishthartaja, that is Daurudaja type. 5 types he has described: Vataja, Pittaja, Kaphaja, Sannipatika, and Dvishthartaja. So subtype of Dvishthartaja he has described either as a Daurudhaja type. Next, coming to the Sushruta Samhita, Sushrutacharya has also described Garbhini Chardi as a Vyaktagarbha Lakshanani, and very interesting word he has added, Apanna Sattva. Meaning of Apanna Sattva is nothing but the Garbhini. That is Nidana for Chardi is Apanna Sattva or Garbhini Avastha, and Daurudhaja also he has described. Next, coming to the Ashtanga Sangraha and Ashtanga Rudhaya, Dvishthartaja Chardi is described, and subtype of that Dvishthartaja Chardi he has described as Daurudhaja Chardi. Next, coming to the Madhava Nidana, Nidana of Chardi is directly he has described as Garbhini. Garbhini Avastha is the cause for the Chardi, and in Agantuja Chardi, that is 5th type, just I told you, Vataja, Pittaja, Kaphaja, Sannipatika, and Dvishthartaja. So in that Vataja, Pittaja, Kaphaja, Sannipatika, and Agantuja. So according to Madhava Nidan, he has made 2 types of this Agantuja Chardi. First is Dvishthartaja, and next point, heading is not given, but in that subtypes are described like Krimija Chardi, Trishnaja Chardi, Amaja Chardi. In that Daurudaja Chardi he has described. Next, coming to the basic Samhita available for our subject, that is Kashyapa Samhita. So in Kashyapa Samhita, if you go through the Kashyapa Samhita, in Hilasthana, Garbhini Chardi types and management is described. Only types, dosha, vataja, pittaja, kaphaja, tridosha, types are described, and based on the types, only management of that Chardi is described. Coming to the Harita Samhita, Haritacharya has put this Chardi under Garbhodravas. Garbhodravas, definitely, he told a clear-cut idea he has given about Garbhodravas. Garbhodravas are the diseases occurring to that pregnant lady, to that Garbhini, during pregnancy, due to the presence of that Garbha. Here, so many times students get confused. 2 words are there starting from the Garbha word, Garbhopadrava and Garbhavyapat. Totally different meaning of these 2 words, though these 2 words start from the Garbha. So Garbhopadravas are the diseases occurring to that pregnant lady during pregnancy due to the presence of Garbha. So Shosha rullasa.chardi Shofas Trishna Tatharuchi Atisaro Vivaranatvam Ashto Garbhopadrava Smrita. This is according to Haritacharya. Garbhavyapata means diseases occurring to that developing Garbha. Okay, so here according to Haritacharya, he has described Garbhini Chardi as a Garbhopatra. So these are the references for this Garbhini Chardi from our Ayurvedic classic. Next, coming to the definition of this Garbhini Chardi, Chadayat Ananam Vegair Udaryan Anga Bhanjanaihi Dosho Vakra Vinishcharam. Very nicely, Sushrutacharya has given the definition. Vitiated, what is the simple meaning of that? Vitiated dosha, rush up to mouth, and after chadayan means after covering the mouth or oral cavity, they come out with great difficulty, and with that anga bhanjanehi means pain, body ache is there, or pain in the body is there, body ache or shula is there. Next, coming to the Nidana, just I told you the references from our Ayurvedic classics. So in short, again, I don't want to repeat the names of our respectable Acharya. So in short, we can take 4 Nidanas. First is, according to Acharya, Apanna Sattva or Garbhini Avastha. Next is Daurudha Avamana, means if we are not fulfilling the demands of the pregnant lady during pregnancy. Demands of the pregnant lady during pregnancy are called as Daurudha. So if you are not fulfilling that, that is called as Daurudha Avamana. Next is Vata Vaigunya Janya or Vata Vaigunya is cause described by our Madhava Nidanacharya. And next, Dosha Vitiation for Dosha Chardi. Kashyapacharya told that dosha vitiation is the cause behind the dosha chardi occurring during this Garbhini Avastha. So, Nidana, 4 points you should remember. First is Apanna Sattva or Garbhini Avastha. Next is Daurudha Avamana, non-fulfilling the demands of that pregnant lady during pregnancy. Next is Vata Vaigunya and Dosha Vitiation for Dosha Chardi. Next, coming to the Samprapti. Shloka is there. Shlokas are also very important. You should by heart the shloka. Doshan udirayan vruthan udano vyana samnataha urdhvam agacchati bhrisham viruddha hara sevana. And this is from Sushruta. Next is Sushruta Uttara Tantra. Next is Amashaya Utklesha Bhavahi Sarva Chardayo Mataha. So what is the meaning of that? In short, I like to explain the Samprapti. During pregnancy, Garbha Pidana is there, Daurudha Avamana is there, and lack of Garbhini Paricharya is there. Due to that, vitiation of Vata, Agni Mandya, due to that, Kapha Dushti, Pitta Dushti, Kapha Vruddhi, Pitta Vruddhi, Utklesh of Kapha Pitta Dosha, due to that Ama Sanchaya in Amashaya. This Utklishta dosha obstructs the passage of Gati of the Vata or Avarodha to Vata Gati. Udana and Vyana Vata Gati is obstructed. Due to that, Amashaya Shlobha is there, Amashaya Shobha is there, and these Utklishta dosha are expelled out through mouth by the action of Udana and Vyanavana and resulting in the Chardi, resulting in Garbhini Chardi. Vitiation of Udana and Vyana, Dushti of Pitta, Kapha, Udirana of Pitta, Kapha, Amashaya, Utklesha. These are the basic important changes occurring behind this Samprapti of this Chardi. Next, coming to the Purva Rupani, Rullasa, Udgara Avarodha, Praseka, Lavanastanu, Dvesho Annapanecha, Bhrisham Vamina Purva Lakshanam. This is from Madhava Nidan. Rullasa. Next, Udgara Avarodha, Praseka, excessive salivation, Lavanastanu, salty taste in the mouth, salt, definitely salty taste in the mouth, Annapana Dvesha, she is not interested to take anything. These are the Purva Rupani of this Garbhini Chardi. Next, coming to the Bheda or types of this Garbhini Chardi, according to Charakacharya, just I told you, Eka Doshaja 3, Tridoshaja 1, and Vishtarthaja. So Vataja, Pittaja, Kaphaja, Tridoshaja, and Vishtarthaja. That is important for us. So which subtype of Vishtarthaja is Daurudhaja. According to Madhava Nidana, Vataja, Pittaja, Kafaja, Sanipatika, and Agantuja he has described, and subtype of Agantuja, Daurugaja he has described. So these are the types. Then Lakshanani or Rupani, easily you can catch the point because you have studied this Chardi, Vataja, Pittaja, Kafaja in the UG classes. So for coming to the practical point, so for practical purpose, from my angle, I like to divide this chardi in three types. First, Praseka, rullasa, chardi, etc. Gharbhini Lakshanani we get during pregnancy can be correlated, which are in very mild form, can be correlated with emesis gravidarium or morning sickness or simple vomiting of pregnancy. Next, Dauruda Janya or Dauruda Avamana Chardi. This can be correlated with hyperemesis gravidarium or severe type of vomiting occurring during pregnancy. Next, coming to the third point, Doshaja Chardi described by Kashyapacharya, definitely Doshaja Garbhini Chardi described by Kashyapacharya can be correlated with associated vomiting of pregnancy. Up to some extent, I like to correlate all these causes described by Ayurveda with these things. This is my view. Next, coming to the upadravas or complications of this Garbhini Chardi, Kasa Shwaso, Jwarastrishna, Hika Vaichityamevacha, Rudroga Tamakaschaiva, Deya Charde Upadrava. This is from Vangasena. So Kasa, Shwasa, Jwara, Trishna, Hika, Vaichitya, Rudroga, Tamak Pravesha or Tamak. These are the Upadrava of Garbhini Chardi. So Kasa, vomiting there. So definitely this is there. Due to that pharyngeal irritation, definitely she get this symptom. In practice also, we get this symptom in the patient suffering from Garbhini Chardi. Shwasa, if continuous vomiting is there or repeated vega of vomiting is there, slight breathlessness also she feel. So definitely we can tell Shwasa is the upadrava or complication of this Garbhini Chardi. Jwara, it's very difficult to tell, but Trishna definitely excessive vomiting, dehydration is there. So she feel Trishna or thirst. Next, Hikka, again due to irritation of this pharynx, we get Hikka symptom in the patient. Then Vaichitya, disturbed mind, because afterwards we will study in detail according to modern sciences. So disturbed mind, because this incidence of emesis gravidarium is more in primigravida. 50% primigravida suffers from this emesis gravidarium or morning sickness. So incidence of simple vomiting of pregnancy or emesis gravidarium is very high. 50% incidence is there. So we have lot of scope from our Ayurveda for the treating this Garbhini Chardi. And what I am telling this Vaichitya or disturbed mind. She is pregnant for first time, and after 6 weeks of pregnancy, just in early, after 6 weeks or seventh week, she get this symptom. So newly married lady, amenorrhea, and just she's getting this disturbing symptom. So definitely her psychology also get disturbed. So vaichitya or disturbed mind, definitely we get as the upadrava or complication. Next Rudroga. Here what I feel, Rudroga we can't take as the diseases of the heart, serious diseases of the heart, but what I feel, Rudroga can be correlated with chest pain. So continuous vega of vomiting. So due to that, she may feel discomfort, not pain, but chest discomfort or chest heaviness due to continuous wave of this vomiting. And tamaka means she feel darkness in front of her eyes. Get darkness in front of her eyes. So these are the, or feels blackout. She feels blackout in front of her eyes. So this also clinically we get in the practice as a upadrava. So these are the upadravas or complications of this Gharbhini Chardi. Next, coming to the Chikitsa, very important point clinically, a very important and interesting point, that is Chikitsa. So first, Samanya, we should think about the Samanya Chikitsa. So this is the shloka from Charaka Chikitsa Sthan describing the Samanya Chikitsa or Gharbhini Chardi. Our Kashyapacharya told that we should filter the points given in the Samanya Chikitsa, keeping in the mind that our patient is pregnant. We should compare her with Gruta or Taila Purnapata. So from this Samanya Chikitsa, which point we should take? I like to tell you. Amashayot Klesh Bhavahi Sarvachargyo Mata Langhanam Eva Tasma. So here, what I like to feel, Langhana we can advise. You can ask me, excessive vomiting is there, dehydration is there, and how, madam, you can advise Langhana. So here, Yukti, we should use Yukti, or so many times I am telling 5 senses are God-given senses, but 6th sense is common sense, which is very uncommon today. Okay, leave joke apart, but Langhana we can take. So Langhana for fatty and spicy substances or food items. So snigdha and tikshna, katu dravya should be avoided, is nothing but the Langhana. Next, Samshodhanam va pitta, kapha pitta, hariti, churnani, Bijan, Madhurya, Abhyudhanam, Vayani, Virechana. Here in this sutra, Vaman, Shodhana is advised. After Langhana, Shodhana is advised. So Vamana also advised. See that Valli Phaladher, Vamanam Pibesha, Yodurvala. Okay. So Vamana is advised and Virechana is advised. So, but don't think what our Kashyapacharya told. So here Vamana is contraindicated totally during pregnancy. Next option is there, that is Virechana. So we think about that Virechana, but Rudhya Virechana or Mrudu Virechana, or better is Anulomana. We can give the Anulomana or Rudhya Virechana or Mrudu Virechana. With Abhaya you can use Haritapi, or Abhaya you can use Dugdha. Paya also they have advised. So Dugdha also we can advise, or Saumya Virechana or Rudhya Virechana with Mrudvika or dried black grapes also we can use, which is diet for that pregnant lady and which act as a Saumya Virechana or Anulomana also. Next, if Langhana we can advise, Mrudu Virechana or Rudhya Virechana or Anuloma you can advise. But if patient is very weak, we are unable or she is unable to take this Saumya Virechana also, then Shamana Chikitsa, Durbalastam Shamana Chikitsa. If you feel it is she is not fit for that, you can come to the Shamana Chikitsa. Shamana Chikitsa with Rasair, Manodnair, Labubhi, Vishushkai, Bhakshai, Savojai, Vividescha Pane. So Manodnair means what she likes to eat, what she likes to use, that type of rasa. Shushka anna, shushka bhaksha, shushka eatables, and pan also you can give, which she likes to eat. So this is the some points we can take from the Samanya Chikitsa Sutra of Chardi, and definitely we can apply today also in practice for treating this Gharbhini Chardi. Next, coming to this point also we can apply, that is Gharbhini Vyadhi Samanya Chikitsa Sutra. You have studied, only I like to tell you. Vyadhis Chascham, Mrudu, Madhura, Shishira, Sukhai, Aushada, Ahara, Vihare, Upachare. This is from Ashtanga Sangraha Charisthan. So if pregnancy vomiting is there, you can use Mrudu, Madhura, Shita, and Sukha, means which she feels comfortable. So this Gunatmaka, Aushadha, Ahara and Vihara you can advise. Next, third point also we can apply while treating this Gharbhini Chardi, that is agreeable attendance and desired articles we should advise. Why agreeable attendance? Afterwards we'll study in detail about this pregnancy vomiting, but neurogenic factors, psychology or psychological factors are also involved, are also the cause behind this chardi. So Ashwasana Chikitsa or agreeable attendance by the doctor, by the sisters, by the relatives, also very important, and desired articles. What she feels better, we should give her to eat. So after this about treatment accepted, if she has accepted above mentioned treatment and now Vegas are reduced, then you can give this Bhunimba Kalka with sugar in same quantity, Shunthi Bilva Kashaya with Yavachura, next Dhanyaka Kalka with Tandulodaka with sugar. Very nice results I have with this. I have taken trial on this for 50 patients and 20, I got good results in 45 patients. So Dhanyaka Kalka with Tandulodaka and sugar. Very easy to prepare. All these things are available in the home easily. This is nothing but the homemade remedy. She can make it at her home and take. Next, Bilva Phalamajja with Lajambu also we got good result. Next, in Chardi, excessive vomiting is there, Dhatu Kshaya is there, Vata Vriddhi is there. So if excessive vomiting is there, excessive dehydration is there, we should think about Samanya Chikitsa and Sadhyo Tarpana or Sadhyo Bruhana. More useful is Sadhyo Tarpana. For that, Harjura mantra you can use. Next, coming to the Vishesha Chikitsa described by Kashyapacharya, based on the vitiated dosha, they have advised the Chikitsa for Vataja, Chardi, Leha prepared with Matulunga Rasa, Lajja, Kolamajja, Dadini, Sharkara and Madhu. Next for Pittaja, Tandulodaka, Sharkara, Madhu, Laja Churna, Chaturjataka Kalka with Pushpagandha. Next, Laja Peya with Madhu and Sharkara. For Kafaja Chardi, Kafaja Gharbhini Chardi, Amra, Jambu, Pallava, Shita Kashaya, we should prepare of that, and with Madhu you can use. I have taken trials on this also and I got very good results. But getting Amra Jambu Pallava for 12 months is not possible. Amra in this season and Jambu also in this season, that is March, April, in this May. From January we can get January, February, March, April, May. Up to June we can get. So during that season, if you get the patient, you can use this. I have trial this on the patient and I got very good result. Out of 50 in 47 patients, I got very good results, and all things are easily available. So good combination. Next, Mudgayusha, Dadim Bij, Lavana and Ushna Navanita. I got good result with this also. Mudgayusha, this is from our Ahara. Dadima Bij also, we are happily advising her to eat dadim or pomegranate. So many uses of that we will study afterwards. We will think afterwards. In that for test only, very pinch of salt, very little salt you should add. And that Ushna Navanita. Navanita, you should make it hot. When it becomes liquid, you should add that and tell her to take. This is also gives good result in the practice. Then in Sanipataja, based on the dosha, based on the predominance of the dosha, you can give the treatment. Though Kashyapacharya has described these treatments based on the vitiated dosha, in practice, for this simple vomiting of pregnancy, if you are unable to identify the predominance of dosha, you are unable to identify the predominance of dosha, leave that predominance of dosha, use any combination. Use any combination from this advised by Kashyapacharya for Vataja Chardi, Pittaja Chardi and Kafaja Chardi. If you are If you are able to identify the predominant dosha, then it is very good. But if you are unable to identify specific dosha, you can give a combination without thinking about the variation of the dosha. All these give good result to me. I have tried all these on the patients. Then which kalpa you can use? Kalpa made from draksha or draksha kalpas. Madhu you can use. Amalaki kalpa you can use. Next, shunthi also you can use, but in very slight, very less amount to make that preparation tasty. Same about the adraka. Next, shankhavasma. For leaking, you can give with madhu and ghruta. You can mix it, and for leha, you can prepare. And for leaking, you can give to the patient. Next, mautika bhasma also same. Mayurapicha masi. Mayurapicha masi. I have done trial on this. Mayurapicha masi we should prepare. And in that we should add madhu. And for lehan or leaking, if you give good results, we can get. I have tried this. Next, pravala panchamrit. And very nice is mrud bhrishta jala. Mrud bhrishta jala described in our Ayurvedic classics. So I am very much interested to see that is given in books. Can I try it on the patient? So I took the trial of this Mrud Bhrishta Jala. How to prepare this? Mostly you know all the things. Earthen pot or any broken piece of that earthen pot you have to collect from the pot makers or potter, and you should boil on the charcoal. If charcoal is not available, what I am telling to my patient, make it hot on the gas also, because gas HPG gas is available in our houses. So make it hot or heat it on the high flame of that gas, and dip it in the water. Dip it in the filtered water, and at least according to my experience, for 5 to 8 times we should do this with one piece of that earthen pot piece to 1 liter of water. At least for 4 to 5 times we should dip the piece. And this also gives us the good results. Next, what should she take? That is ahara, draksha, or manuka. We can call it as manuka, or mridvika. We can call it mridvika also. Very good diet. As a diet you can advise. Dadima also you can advise her to take in maximum quantity. Next, orange juice also you can tell her to take. Next, takra also, or buttermilk. More good than this takra is siddha takra. Siddha takra, or how to prepare this siddha takra. In this takra you should add slight salt, sugar, and slight ardraka and give her. It gives better taste and it is palatable. It is acceptable by the patient. This is my practical experience. Then mudga, definitely we are using in our diet. Then kulatha yush also. Mudga in the form of yush or in other form also you can use. Then modern sciences, they are advising for morning sickness or simple vomiting of pregnancy, dry biscuits. After getting up in the morning, they are advising eat 2 dry biscuits or eat 2 dry butters after getting out from the bed, getting down from the bed. But here we have good alternative. I have searched good alternative. Our Acharya has told that lajja, they have advised. So I am advising patient to eat these lajjas, 1 fist of lajjas or 1/2 bottle of that lajja they can eat, or very best jawar in our area. Jawar is famous. We are preparing rotis from that. So dry, hot jawar roti she can eat, but before eating we should apply pinch of sandhava lavana, and if old homemade lemon pickle is there in the house. Why I am telling you lemon pickle? Because homemade lemon pickle, why I am telling? Because this is specially they are preparing. How they are preparing? They are adding only lemon, sugar, salt, and red chili powder in very less amount. And for years together, this lemon pickle remains good in good condition. At least leave that years together, but 3, 4, 5 years. So old lemon pickle, some juice from that lemon pickle you should apply on that. Some slight sandhya lavan you should apply, and tell her to eat that dry jawar roti. Very good results we are getting, because only diet changes I am advising, because first trimester is very important period in the life of that fetus, because organogenesis is going on in the first trimester. So as far as possible, try to advise less medicines during the first trimester. And this dry roti is our daily food item, and for lunch also, for dinner also we are eating. So this roti is the daily food item. And acceptance by the patient is also very good. I am not giving advising any medicine, so there is no effect, bad effect, side effect, adverse effect on the growth of the fetus. Okay. Then what is the apatya? Snigdha, Guru, and Vidahi Dravya. These are the apatya. So this is the Gharbhini Chardi according to Ayurveda. Next, coming to the pregnancy vomiting or vomiting in the pregnancy according to modern sciences. Why I want to put all these detailed things at the beginning only, I told that students are going to appear in the September month, and they should know everything, means theoretical things they must know, then practical application I'm going to tell in the last. So Gharbhini Chardi according to Ayurveda, we have studied in shortage of time is there. Next, coming to the counterpart from the modern sciences, that is vomiting in pregnancy. So you have studied in your UGs, but firstly we should revise. So this we can divide into two types: vomiting related to pregnancy and vomiting associated with pregnancy. Then what is this related with pregnancy? Vomiting related to pregnancy means behind this vomiting, pregnancy is the cause. Never forget this. Related with pregnancy means behind this vomiting, pregnancy is the cause. Next, associated with pregnancy. In this associated with pregnancy vomiting, association of both is there. Means vomiting is there due to some other causes than pregnancy, and pregnancy state is there. Okay. So associated vomiting of pregnancy is the vomiting occurring during pregnancy due to other causes than pregnancy. Don't forget this. Okay. So causes we should study in early pregnancy, related with pregnancy, and associated with pregnancy. So causes behind early vomiting, causes behind vomiting occurring in early pregnancy. First, causes behind vomiting occurring in early pregnancy in the related to pregnancy. Okay, so causes behind related to pregnancy vomiting occurring in early pregnancy. Leave that complicated thing. So early pregnancy we are studying, concentrate on early pregnancy. Causes we are studying, related, associated. So behind is early pregnancy, related to pregnancy, or vomiting of pregnancy, which are the causes. So first is simple vomiting of pregnancy, or emesis gravidarium, or this is also called as morning sickness. And next serious form of that is hyperemesis gravidarium. Next, associated with pregnancy. Causes behind is vomiting associated with pregnancy. Here, three types of causes are there: medical, surgical, and gynecological. So in medical causes, so many number of causes are there, but only important I like to narrate here. That is urinary tract infection, uremia, hepatitis, and intestinal infestation or worm infestation. Okay. Next, surgical causes are appendicitis, pancreatitis, intestinal obstruction, and peptic ulcer. Next, gynecological causes are twisted ovarian cyst and red degeneration of the uterine fibroid. Okay, so these are the causes behind associated vomiting with pregnancy in early pregnancy. Okay, so coming to the next point, that is late pregnancy. In that first subpoint is related with pregnancy. So vomiting related with pregnancy occurring in late pregnancy. What are the causes behind this? First is continuous or continuation or reappearance of emesis gravidarium of first trimester. And next is acute fulminating toxemia. Acute fulminating toxemia. Next, associated with pregnancy, causes behind vomiting associated with pregnancy in late pregnancy. Medical, surgical are same as just we have studied in early pregnancy. Gynecological also same. So same points you have to take here. Time is short, so I'm not allowed to repeat the same thing. Okay. So before going to study this vomiting, we should get at least gross idea about the mechanism behind the vomiting of pregnancy. See that graph is there, chart is there. So during pregnancy, CRH, corticotropic releasing hormone is increased. Due to that, increase the CRH and adrenocorticotropic hormone. Due to that, inhibition of the path of vagus or inhibition of the action of vagus. Due to that, gastric emptying is affected and end result is stimulation of vomiting center via CTZ or chemoreceptor triggers home. When this center is initiated, irritated, we get the vomiting. So end result is stimulation of the center through CTZ. Next, during pregnancy, some hormonal changes, increased estrogen, blood or serum estrogen levels are increased. Last, see that progesterone, blood progesterone levels or serum progesterone levels are increased. See both hormones, estrogen and progesterone levels are increased. Due to that, increased nitric oxide. Serum level nitric oxide are increased, and due to that, gastric emptying is delayed. Delayed gastric emptying and end result is stimulation of that chemoreceptor trigger zone or stimulation of the, more correctly, stimulation of the vomiting center through or via CTZ or chemoreceptor trigger zone. Next hormonal changing S is SCG, increased or high levels of human chorionic gonadotropic hormones, or in short SCG increased. Due to that, C, magnesium homeostasis is affected. Due to that, lowered levels of magnesium or hypomagnesemia, and due to that, vomiting center is stimulated, irritated, initiated through CTZ, via CTZ or via chemoreceptor trigger zone. So this is a mechanism of vomiting according to modern sciences. Next, coming to the simple vomiting of pregnancy. This is also called as emesis gravidarium, or this is, we can call this as the morning sickness. So what clinical features we get in the simple vomiting? Nausea is there, sickness after getting up in the morning, and slight vomiting is common. Vomitus is clear and very less in amount. And it is, just I told you, it is very, very common in first trimester or in early pregnancy. 50% patient, in 50% cases or patients, pregnant ladies, we get this symptom in the first trimester. So it is very common. And very important point, clinically, it has no any bad effects on the nutrition or on the health of the patient or hydration of the patient. Means there is no any effect on the nutrition, there is no any dehydration, we can't get signs and symptoms of dehydration, and there is no any restrictions to her normal day-to-day activities. Day-to-day activities are not restricted, and with or without treatment, it disappears after 12 to 14th week of pregnancy, with or without treatment. But definitely in practice, it is very irritating symptom to the patient, to the relatives, more than patient, to the relatives also. So definitely we should treat the symptoms. Okay, what are the causes behind this? Altered hormonal status, just I told you, high levels of estrogen, progesterone, SCG. Okay. Next is altered immunological status, and next very important point is neurogenic factors are also responsible for that. Then management according to modern sciences for the simple vomiting or emesis, emesis gravidarium or morning sickness is assurance or ashvasana chikitsa. Nothing to be worried about. This is very, very normal. You should tell her positively. This is the very good signal that you have some living in your womb or in your uterus. This is the signal of new arrival. Like this, you should convince to your patient because assurance is very important, or ashvasana chikitsa. Next movement after getting up in the morning, she should sit in the bed and movements of the hands and limbs are advised. Then just I told you, dry carbohydrate food like bread, I'm sorry, bread they have advice, but I am not advising. And biscuits and toast they advise, means modern sciences. Fatty and spicy food should be avoided. And B1 deficiency is there, so vitamin B1 100 milligrams daily you should give. If up to this you did assurance, you have given ashvasana chikitsa, you have given changes in the lifestyle, changes in the diet or ahar you advise, but still very agoning symptom, very tedious symptom, to the very disturbing symptom still remains, then go for the anti-emetic drugs. But again, I like to stress, again, I like to tell, while advising or while writing any prescription during pregnancy, especially in the first trimester of pregnancy, think twice and advise minimum drugs, minimum possible drugs you should advise, because this is very delicate period for this developing embryo in the first trimester. Organogenesis takes place, so very carefully before writing, think twice, and less medicine during pregnancy, especially in first trimester. Don't forget these two lines. Okay, so if uncontrollable, anti-emetic drugs, Finargan 25 mg BD you can advise, or Espazin 1 milligram BD you can advise, or ondansetron also 4 milligram BD you can advise. But while advising this also, give the medicine for shorter duration. Don't give for 7 days or 10 days. Only for 2 days you should give her and call her back to your clinic. And if it is okay, then tell her to stop this medicine. Okay, so minimum possible medicines you should prescribe during pregnancy. Okay, then plenty of fluids, excessive vomiting, so dehydration may be there. So plenty of fluids you should advise with glucose and fruit juice also you can advise. Next, coming to the hyperemesis gravidarium. Definitely, it is the serious type of vomiting, severe type of vomiting of pregnancy, which has got deleterious effect, bad effects, dangerous effects, deleterious effect on the health of the female, and or incapacitates her in day-to-day activities, or restricts her day-to-day activity. In simple language, which restricts her day-to-day activities. Next, adverse effect of vomiting. Which are the adverse effect of vomiting? Definitely excessive vomiting, due to that dehydration is there, metabolic acidosis is also there. Due to excessive vomiting, electrolyte imbalance also takes place, and weight loss is there. Next, coming to the incidence, very happy to tell that incidence is very, very, very less of hyperemesis gravidarium. So simple vomiting of pregnancy, or morning sickness, or hyperemesis gravidarium has 50% incidence. Okay, so happily we can treat. This is very mild form of vomiting, mild grade of vomiting. But coming to this hyperemesis gravidarium, incidence is very less than 1 in 1,000 cases. In my 30 years of practice, I saw only one case of this hyperemesis gravidarium. For this preventive care also we should take. Okay, coming to the point, etiology. Etiology is obscure according to modern sciences. I am joking here that I am telling to a student, when you are not getting any point about this etiology at the time of examination, you are in the tension, worry of examination, so many things are the stress of examination, and total blank, you are not getting any idea about etiology. Then according to modern sciences, easily you can like exact etiology is unknown, but so many theories are described. So incidence is more with or some points related with etiology. I like to tell you some common points we get, that is mostly this hyperemesis gravidarium is limited in the first trimester, or it is we get this hyperemesis in first trimester of pregnancy only, and this is common in first pregnancy. So incidence is more in first trimester, incidence is more in first pregnancy, and we get positive family history. We get positive family history about this in the patient suffering from this hyperemesis. Next, incidence is more if twin pregnancy is there, or hereditary-form mole or vesicular mole is there. Next, if incidence is more if patient has the history of motion sickness or migraine, then incidence is more. Then coming to the theories, hormonal theory, just this disease is the disease of theories. Exact pinpoint one cause is not there. Probable causes they have described means modern sciences. So first is hormonal, just I told you, high levels of estrogen, progesterone, and SCG, human chorionic gonadotrophic hormone levels are more. So probably this may be the cause. Next is psychogenic cause. Then how we can identify cause, or how we can tell or prove that psychogenic factors are responsible. I have also in books also that is given, but I have also experience about that, how we identify that psychogenic cause. Patient, suppose OPD level patient is there suffering from hyperemesis or okay simple vomiting. I am treating her 2 3 days 4 days, but still symptoms are there. Then excessive vomiting, so she is not able to take, so dehydration may occur, and to avoid next complication, definitely I advise her to admit in my hospital. So it is very dramatic thing to see, or dramatic experience. As we admit the patient in our hospital, we follow same medicines which you are advised when she is on the OPD basis case, same diet. So with same diet, same medicines, dramatically symptoms get relieved. So definitely in that case, psychogenic factors are responsible. Next is dietetic deficiency. Some deficiencies in the diet like vitamin B1, B6, B12 and C. Especially in vegetarian diet, B complex is less, or vegetarian people suffer from B complex deficiency. Next, allergic or immunological basis. Some substance secreted by the trophoblast, this may act as an allergen to the mother and produce the vomiting. These are the theories. Next, what is the vicious cycle in this vomiting? Vomiting due to that carbohydrate starvation, due to that ketoacidosis, and vicious cycle get completed. Due to that ketoacidosis, again vomiting occurs. Next, coming to the pathology, in short only we should think about this pathology. No specific morbid changes we get, but some changes which we get in the liver, enzymes are increased, liver enzymes are increased, in kidneys fatty changes, slight fatty changes we get. In heart, size of heart becomes less, reduced, and some endocardial hemorrhages we get. And in brain also some hemorrhages in hypothalamic area. We are studying about the hyperemesis gravidarum and pathology of that. Okay. Next, coming to the next slide. Some changes due to dehydration and starvation. Definitely, hyperemesis vomiting, I'm sorry, hyperemesis gravidarium, excessive vomiting due to that dehydration is there and starvation is there. So due to this dehydration and starvation, some metabolic changes, biochemical changes and circulatory changes we get. Then which are these metabolic changes? Why this takes place? Inadequate intake is there, due to that glycogen depletion is there, and that for energy supply fat is broken down. Due to decreased carbohydrate, fat is broken down. Next, incomplete oxidation of that fat occurs due to that accumulation of ketone bodies in the blood, and acetone is secreted through the kidneys and through the breath. Next, biochemical changes, acidosis due to starvation, due to excessive vomiting, due to starvation. Next, alkalosis due to excessive loss of hydrochloric acid in the vomiting, and with that hypokalemia is there. Next, salt and water is also lost in the vomiting due to the decreased plasma sodium, potassium, and chloride levels we get. Next, hepatic dysfunction is there due to that ketosis, increased blood urea level, and increased uric acid. Uric acid levels are there. So in short, hypoglycemia, hypoproteinemia, and hypovitaminosis we get in hyperemesis gravidarum. Next, circulatory changes. In this circulatory changes, excessive vomiting, dehydration, so hemoconcentration is there. Due to that, increased HB level, increased RBC count, increased hematocrit count, increased WBC count also. Next, coming to the clinical type. Clinical type. Yes, coming to the clinical type, based on the severity, we can divide this hyperemesis into early and late. So early stage of hyperemesis gravidarium, generally patient is nulliparous patient in early pregnancy, and onset is insidious. Suddenly it starts. Then which finding we get this in this early stage of this hyperemesis? Only activities of the patients are restricted without the evidence of dehydration or starvation. Only activities are restricted. There is no any dehydration or starvation. Vomiting independent of food, and throughout the day it is spread throughout the day. And everything taken through the mouth is ejected, thrown out, vomited out. Nutrition of the patient is not affected, and on general examination, we are not getting any abnormal finding or any finding of dehydration. So general examination normal, and blood urine investigation reports are also normal. There is no any abnormality in blood or urine. Next, coming to the late stage of hyperemesis gravidarium. Here, evidences of dehydration and starvation we get, but today we are very lucky. We are not getting the cases of this stage. So late stage hyperemesis gravidarium cases, we are not getting today to see. Very rarely we can get the case. So which findings we get? So symptoms, firstly we should go vomiting, increase in amount and frequency also. Between these two vomiting, she feels nauseating sensation also. Next, color of that vomitus is coffee ground color, or it contains blood also. Next, excessive vomiting is there, dehydration is there, starvation is there, definitely urine output is decreased, oliguria is there, constipation, or in some cases we get diarrhea also. Epigastric pain is there and patient confined to bed. Next, coming to the symptoms, one more symptom I like to add, symptoms of complications. If you are not treated the case in the time, symptoms of complication, which are the complications? Wernicke's, encephalopathy, psychosis, peripheral neuritis. So complications of these symptoms we get. Next, coming to the signs, progressive emaciation and loss of weight is there, anxious look of the patient is there, or signs of dehydration we can get, sunken eyes, inelasticity of the skin, coated tongue, coated teeth are also there, tachycardia, hypotension, hyperpyrexia is there. In severe condition, jaundice we get, or more severe things we get neurological manifestation like squint or different palsies. Next, investigations which we want to do during examination, routine and microscopic. Here details you can get, that amount urine output is decreased, so dark yellow colored urine is there, specific gravity is also increased, acidic reaction is there, presence of acetone is there, occasionally protein is there, and very rarely we get bile pigments in the urine. Then next is serum electrolyte, sodium, potassium, and chloride levels are disturbed or reduced. Next, coming to the ophthalmoscopic examination or eye examination or fundoscopic examination. Through that fundoscope, if you see the fundus, we get the retinal edema or retinal hemorrhage, and in very worst case, retinal detachment also we get. Next, coming to the other, one more investigation, that is ECG, to get the idea about the potassium levels. You should go for the ECG. Thyroid profile, because in this T3, T4, TSH, you should do, because thyroid dysfunction is also there with this. For that, you should go for thyroid profile. Next, coming to the diagnosis, clinically very important point is diagnosis. First thing you should do, that confirm the pregnancy by doing ultrasonography, if required by doing PV examination. First confirm the pregnancy. Okay. Next point very important in that diagnosis is associated causes should be ruled out, should be excluded before pinpointing that case as a hyperemesis gravidae. So diagnosis first, confirm diagnosis of pregnancy by doing ultrasonography or PV examination, but ultrasonography is better because early pregnancy. With experience, you can diagnose early pregnancy at 6 weeks also. So USG or PV examination. And next point, other causes. Just I told you, other causes like medical causes, surgical causes, gynecological causes behind this associated vomiting of pregnancy should be ruled out. And then if no any other cause for associated vomiting, then you can label that vomiting that this is the hyperemesis gravidae. Next, coming to the complications. Complications are due to dehydration, starvation, and ketoacidosis. But today we are lucky enough that very rarely we get these complications. Why? Because today we are there. Good management protocol is there. Patients are also aware. Lot of things I want to tell, but shortage of time is there. So patients are coming to us regularly at early stage. They are coming to us. We are there to treat. So many good drugs, antiemetics are available, antihistaminics are available. If need is there, IV fluids are there. So we are there to treat with good medicine. So we are lucky enough that severe stage or late stage of hyperemesis gravidium today we are not getting or very rarely getting, and complications of this hyperemesis gravidarium we are not getting today or very rarely we are getting. Then coming to the management. First important point is preventive. Preventive aspect is very important. So effective treatment of simple vomiting, definitely. If she is suffering from simple vomiting, at that stage only with our treatment, without any antiemetics from modern sciences, antihistaminics from modern sciences, changing diet or using some compounds, definitely we can prevent. Next, curative. Oh, I have given all the treatment, I have tried my best, but still vomiting is there. Still frequency is increased, still amount of vomitus is increased, still dehydration is there. Condition of the patient is worsening, then I should admit the patient in the hospital. After admitting in the hospital or hospitalization, just I told you, psychogenic factor is there. So in so many cases, after hospitalization, if you are not having experience, try this on the patient. You have started the treatment, patient is not responding. Admit her in the hospital and put her for one day, at least for 24 hours, on same treatment, same medicines, and same diet. Definitely, in 90% cases, all symptoms get vanished because manas or psychological, psychogenic factors are there. Okay. So next, coming to the fluids after admission, you should think about the IV fluids, excessive vomiting, excessive dehydration, starvation is there. So how to give the fluids? Oral fluids withheld at least 24 hours after cessation of vomiting. So how to calculate the daily intake or daily IV fluids? Total, grossly speaking, total 3 liters of fluid per 24 hours, plus we should add amount of vomitus and urine output. So 3 liters plus amount of vomitus in mLs and urine output in mLs you should add. So this 3 liters, how to divide? Half from that means half fluids you should give 5% dextrose and half you should give Ringer's lactate. Okay. Next, coming to the drugs, potent, good, effective antihistaminics and antiemetics are available with her. With us, sorry, Finargan is there, which contains promethazine 25 mg, OD or BD depending on the need of the case, or Stemetil also you can advise, injectable 5 milligrams OD or BD, or Sequil. I'm sorry, Sequil 10 mg OD or BD you can advise depending on the need of the case. Next, vitamins you should add B1, B6, B12 and vitamin C, definitely intramuscularly. Then hydrocortisone in severe cases, still I am treating, IV fluids I have started, vitamins started, antiemetics I have started, antihistaminics I am giving, but still BP is coming down, hypotension. Then in this case, I should start the hydrocortisone drip. In severe hypotension, only you should go for hydrocortisone drip. Next, care of the bowel. Care of the bowel, here, if required, we can use enema or soap water enema. According to modern sciences, we can use our Nirobasti nicely, but good option is available with us. Just we will discuss about that. Next, nursing care, especially for oral hygiene, nursing care, oral hygiene, she should take care of oral hygiene of the patient. Then sympathetic but firm attitude or handling of the patient is very necessary. Next, we should maintain the hyperemesis chart, in that which one should be maintained, amount of vomitus, amount of urine output and IV fluids which we have given. So intake and output in mLs or cc's should be noted. Next, TPR, BP or temperature, pulse, respiration and blood pressure at the interval of 2 hours or 3 hours or half an hour depending on the need of the case. Next, we should see the character of vomiting. Third point is character of vomiting. Next, blood examination, blood biochemistry. Next, ECG also, we should go for ECG. Next, urine examination. Next, ophthalmoscopic or ophthalmoscopic examination, that is called as fundoscopy, to see the retina, changes. All these things we should do. If possible, weighing of the patient, weight of the patient also you should see. Next, coming to the diet. How to advise diet, when to start the diet. So before stopping IV fluids, oral food should be started. If she is accepting, okay, slowly you can curtail and stop the IV fluids. If she is unable to accept, we can continue the IV fluids. Then just I told you, starting with what they have advised, same thing where our acharyas also advised. So dry carbohydrate diet they have advised. In practice also same thing, just I told you, biscuits or toast, dry toast or biscuit, good option we have, that is lajja. Or one more interesting option which I have tried on the patient, I will tell you. Or you can give jawar roti, or hot jawar roti, put some saindava lavana on that, put some homemade ghee on that, and put some juice from the homemade lemon pickle. It is very tasty and acceptable by the patient. This is my experience. So this is about the diet. They have advised biscuits or dry toast. They have advised. So this is about the diet. Next, about termination. Today, very rarely termination is indicated. Termination means termination of pregnancy is very rarely indicated, because we are there. Just I told you, I don't like to repeat again same thing. We are there. Good medicines, IV fluids, good nursing staff we are having. We can take good nursing care, and end result termination is not necessary, but rarely it is indicated. Good reference from our Ayurveda also. Here I like to narrate that sutra. Avishaye vikaretu shreyo garvasya patanam na garbhini viparyasat tasmat prapto na hapaye. Our Acharya also told same thing. Maximum possible efforts we should do to avoid the termination with our treatment, avoid the termination. But avishaye vikare, when the disease of Gharbhini, when the Garbhopadrava or disease of pregnant lady becomes very serious, when it affects the health of that Garbhini. So avishaye vikare, so we also feel very bad to advise this. Patient also feels very bad when avishaye vikaretu, means when disease of the pregnant lady becomes very serious, shreyo garvasya pataram, go for the termination of pregnancy. Avishaye vikaretu shreyo garvasya pataram na garbhini viparyasa tasman prapto hape. At that time, we should think about the health of the patient or health of the pregnant lady. Okay. So what are the indications for this termination? Deterioration of the condition of the patient. I am giving everything, but still patient is not responding, but condition of the patient is becoming worse daily and daily. Condition of the patient is worsening. No alternative in our hand. If tachycardia, severe tachycardia is there, if severe or increased body temperature is there, or hyperpyrexia is there, and if oligouria, increasing oligouria is there, it indicates kidney failure. So to save the life of the mother, we should go for the termination. Method of termination for first trimester, we can go for MTP or for the D&C. We can use the methods D&C. So next, coming very interesting point, coming to the correlation and practical application. This correlation is, according to my view, I am correlating. So see, Nidana, according to Ayurveda or according to our Acharya, they told Garbhaja, due to the presence of that Garbha, due to the presence of that embryo inside the uterus, vomiting occurs. Same thing modern science has told, due to pregnancy state, definitely due to Garbha only, due to embryo only, and change in the hormonal level. Just I told you, increase in the estrogen, increase in the progesterone, increase in the chorionic gonadotropic hormone, human chorionic gonadotropic hormone is there. So same thing they have advised. So many times I am telling to my student, if you go in the depth of Ayurveda, What is the difference between Ayurveda and allopathy? Only language differs. Our classics in Sanskrit, allopathy or modern sciences is English. So only difference of language, nothing else. But we should go in the deep, go in the depth. I'm sorry. Next point is Dauruda Avamana. You have got the idea about Dauruda. Dauruda means longing is or desires. Desires expressed by the mother during that pregnancy state. So these desires, avamana, if you are not fulfilling the desires, according to Ayurveda, what we desires any normal person, what is less in our body, what is deficiency, what is deficient in our body, that we want to take. Definitely, this is the basic principle, and in practice also we feel this. When we become thirsty, we want to drink drink the water. So Dauruda Avamana means Dauruda. First Dauruda, she want or she like to eat something. Okay. So if Dauruda Avamana is there, and why Dauruda? Something is deficient in what I feel. This is my personal opinion or personal views. So what she wants to eat, that is deficient in her body, what I feel. So we should give her. But if we follow Dauruda Avamana, we have not fulfilled her demands, then easily, definitely we get the Dauruda Avamana Vyadhi or disease. This can be seen, thinking deep and come to the correlation. Dietetic deficiencies. According to modern sciences, they told that some dietetic deficiencies like B complex deficiency, especially B1, B6, B12, and vitamin C deficiency. So that can be correlated with this. Then Vata Vaigunya, Madhav Nidhanacharya, Madhav Nidhanakar told that Vata Vaigunya is there. So I want to correlate same thing, only Sanskrit description, here English description. So psychogenic factors and through CTZ, though that is simple vomiting of pregnancy or hyperemesis gravidarum through CTZ, through chemoreceptor trigger zone, or in short, through the nerves or through the Vata. So this definitely Vata Vaigunya can be correlated with psychogenic cause or through the CTZ, stimulation of that vomiting center through that CTZ or chemoreceptor trigger zone. So next, coming to the Samprapti, see carefully, Pitta, Kapha, Udirana and Ama Sanchaya. Amashaya Utklesha. Ama Sanchaya is also there and Amashaya Utklesha is there. So due to Utklesha, excessive amount of Udirana or Sanchiti or of Pitta Kapha dosh is there in the Amashaya. Okay. So Sanchiti or collection of the Pitta Kapha, Udirita Pitta Kapha dosha, Ama Sanchiti in the Amashaya easily can be correlated with decreased gastric emptying. This is my personal view. Next, Udana Vyana, definitely in Samprapti. Udana Vyana, in that Samprapti we have studied just. So Udana and Vyana Vayu is involved in that Samprapti, can be correlated with CTZ stimulation or through CTZ stimulation of the vomiting center. Next, coming to the treatment, see only difference of language. Langhana is advised according to Charakacharya, General Chikitsa or Samanya Chikitsa of Chardi, we have studied. In that they advise the Langhana. So I can tell you that follow the Langhana, or I tell my patient to follow Langhana for spicy and fatty food, or they are telling avoid spicy and fatty food. Same thing. Langhana for spicy and fatty food. Then Mrudu Anulomana. Mrudu Anulomana, our Acharya advised, they have advised the enema. Next, Shamana, Laghu, and Shushka Bhaksha. Laghu and Shushka Bhaksha, they have advised. See, modern sciences, they have advised dry biscuits and toast, very light to digest, and Shushka, very dry. So Shushka and Laghu Bhaksha can be correlated with things like dry biscuits and toast advised by modern sciences. Next, coming to next slide. Phala, Peya, Leh, advised by our Acharya. Phala or Phala Rasa, Peya, you know how to prepare Peya, less time is there. Okay, then Leha is also advised. Leaking is also advised. Same thing, they are also advising fruit juices, glucose, and water also. Next, coming to that next point, Siddha Jala, they have advised. Modern sciences, plenty of water, they have advised. But what is my experience? If you tell patient, hey, drink water in more amount, it is not acceptable by the patient. But if you prepare the Siddha Jala, easily it is acceptable. Very good results of Siddha Jala. Mrud Jala is very best option for this plenty of water. Next, Draksha. See, our Acharya, they have advised Draksha, Madhu, dry Draksha we are advising, or Manuka we can call or Mrudvika. In Sanskrit, Mrudvika, Draksha, dry grapes, Madhu, Amalaki, Dadim, Ardrak or Ardraka Pak I am preparing and giving to the patient. So Ardraka or Ardraka Pak, according to the same here what they are advising or what are the contents in this Draksha, Madhu, Amalaki. It is full of these vitamins, all B complex, B1, B6, B12 and vitamin C also. Next, this is my personal preparation which got very good result. Some modification because so many things are described in our Ayurveda. So in that form, it is not possible to advise the patient or it is not possible, it is practically it is not possible for the patient to follow. So some changes by using Yukti Pramana, I did it because our Acharya have also told these things we are describing, but according to Desha, according to Kala, according to Satmi, you can make the change in that. So taking this reference here, I am prepared this and advising this, not prepared, but since 5-10 years, I am using this, especially for my PG students who are carrying. So in first trimester, it is worst symptom in the first trimester. So advised and today also I am advising for so many patients also. So Lajja Laddu, this is my personal preparation. Lajja or you know the Lajja or popped rice, you can call it as popped rice. In our area, it is easily available. So Lajja of rice only. Next, we should powder it in the mixer. You can put it in the mixie and make the powder in that same amount of sugar. Same amount of 1 measure of lajja powder, 1 measure of sugar, fine sugar, powder sugar you should add in that, and some amount of ghee you should add in that. And for good flavor acceptability, you can add cardamom in that. In that you can add cardamom powder also. And ghee, how much ghee we should put when we put this powder of lajja and sugar, mix it properly and add the ghee in that amount that from that dung you can prepare the laddus or balls, laddu in English, but balls. So lajja balls you can prepare and practically also it is very easy to take. So after getting up in the morning, tell her to eat on empty stomach this small ball or lajja laddu or lajja ball. Very good results I am getting with this. Okay. Next, just I told you in our area, jawar roti in every house in the morning they are preparing so bishi jawar roti with slight saindhava, with slight lemon juice. I'm sorry, lemon pickle juice and slight ghee, homemade ghee. If you put very good tasty combination and not only tasty but it is acceptable by the patient. Then next is lemon sarbat. Very nice acceptability for this lemon sarbat. Easily it is available in the market all over India. Also lemon are available. Next dadim also available. Tell her to eat dadim beej or if possible juice. But what is my advice? Advise eating that fruit in that raw form. Don't take the juice from that. So orange, you should tell her to eat dadim, good acceptability after getting up in the morning or in the day also, in full day also, in the morning, in the afternoon, in the evening also she can take. So better to take eat fruit as it is than taking or drinking juice of that fruit. Next, Siddha Takra is also, just I told you, very good option. Takra, you should add in that pinch of sugar, pinch of sandhav lavan, and slight ardraka to make it tasty. So very nice combination, and acceptability is also very good. Then lemon pickle, just I told you, lemon pickle, homemade pickle, old Purana pickle, or Purana or old pickle of 2 years, 3 years old pickle is very good option for all the modern medicines. It is my experience. Then Amalaki Paka. In so many houses, this is the traditional preparation. They are preparing in the house. How they are preparing? They are making the sugar juice, means sugar, in that they are putting the water and making the pak of that. Avaleha preparation, you know, time is less. So in short, I like to tell you. So this is also Anubhuta Chikitsa, you can call. But in every house, they are preparing traditionally. That is Amalaki Pak. In our Marathi, we call, or in Maharashtra, we call it as Moravla. Very good, very tasty, and acceptability is nice. 100% acceptability by the Garbhini Chardi, or patient suffering from vomiting. So, Amalaki Pak, how they are preparing sugar, same amount of water or less water you should put, and put on the gas, and pak you should prepare, and two thread pak you should prepare that pak up to two thread, like this you should stretch. When two threads are formed, you should stop, you should uh, less the flame, less the gas or flame, reduce the flame. Then you can add in that amalaki. How to add the amalaki? Definitely good quality amalaki you should take. In November, December, we get, at the time of Tulsi marriage, we get good quality amalaki. At that time, we are preparing, in all houses, we are preparing this. So good quality amalaki, wash them, dry them, and cut them in the pieces. And when this two thread pak get prepared, in that we should add this amalaki, and again boil for at least 15 to 20 minutes, or test that that piece of amalaki is becoming soft. Then you should put off the gas and add the prakshepa dravya, like cardamom you can add, lavang you can add for the taste and easy acceptability. Then bilwa di leha, this preparation I have given to my one student who is the Ashish, Dr. Ashish from Dr. Shreyas batch only. So bilwa di leha we have tried for this simple vomiting of pregnancy, and we got very good results with this bilwadi leha, bilwadi avaleha. So what is the take home message I like to tell? Accept and welcome the signals of new arrival with positive attitude by modifying diet and lifestyle. And next, don't forget, again I am underlining, again I am telling that minimum medicines, advise minimum medicines in first trimester of pregnancy. More correctly, minimum medicines during pregnancy, but specially think thrice or 4 times before advising the medicine in the first trimester. So minimum medicine in first trimester. Okay. So thank you. Thank you all for your patient listening. Thank you one and all. Thank you.
Thank you so much, madam. There is no wrong if I quote this. Yadi hasti tadanyatra yene hasti natat kvachit. A quotation from Mahabharata where they say whatever has been said here may be found elsewhere, but whatever is not found here does not exist anywhere. Pertaining to Gharbhini Chardi, the references what you have mentioned, both classically, the modern view, I guess there is no other any single point left out. This is my personal view. Thank you so much, madam, for that. And in
Can
fact,
you say?
it was an exquisite considering the postgraduate academics, which was dealt in a very unique way, ma'am, with all available references from both classical as well as modern. In fact, you made me a little nostalgic, taking back to my classrooms by
Yes.
the way you dictate each sentence, repeat it again and again, and make us perfect. And I also would like to quote your dialogue telling that 5 senses are given by God, but one sense, that important sense, the common sense, which commonly is not found, has to be kept in mind, and we have to use that when we are treating a patient. Very nice, madam. And the trials, the clinical trials which you have mentioned, of the available various references, is one of the advice for the postgraduate students. Whatever references are available in our classics, they have to be tried out for experiencing the results. Maybe we get it or not, it is secondary, but our duty is to just make a minimum trials. I still remember you giving me 2-3, either apart from my dissertation, there were 2-3 other subjects which you asked me to do work on. And in fact, Gharbhini
Yes.
Chardi was also one in that, I still remember, madam.
Yes.
And
Yes.
and personally, if I feel, if it wasn't you, I am sure that the work which I had taken for my PG dissertation would have been untouched. No other person, probably you had given me that courage to do it, and it was I am thankful for you for that also, madam. And the correlation of the classics with the modern views was very much needed, like the Garbhini Chardi, the hormonal changes, those etc. All those classically as well as modern was very much needed, and you have given that to our postgraduate scholars, madam. And especially the practical preparations, what you mentioned, what you advise to your postgraduate students, or your students who are pregnant, for your patients, etc. We have seen how well you do that, madam. And in fact, you have given that to all our postgraduate students of Prasooti Tantra and Stree Roga. Now the session is open for question answers. We have got 2 questions, madam.
Okay, yes.
So one question, Dr. Shagufta Sheikh has asked, what's the individual role of T3, T4, TSH in hyperemesis gravidarum?
Please repeat again.
What is the individual role of T3, T4, TSH in hyperemesis gravidarum?
Okay. Good question. But I have not references about the research done on this. But as far as my knowledge concern, I like to answer. I like to try to answer this question. Definitely, some dysfunction we get in this thyroid levels or T3, T4 and TSH level. And this may act as a cause because these levels or dysfunction is there in all the patient. Question is very good. In all the cases, if you go, if patient is 50% patient, just I told you, hyperemesis is there, simple vomiting of pregnancy is there, or early stage of hyperemesis is there. But in 50% patient, just I told you simple vomiting is there, sorry. So if we go for the remaining 50% patient, this report we get, that is disturb somewhat changes in that T3, T4, TSH levels. But in some cases, with these changes, there is no Gharbhini Chardi. But in remaining 50%, with these changes, we get the Gharbhini Chardi. So role is there,
Yes.
we tell in 50% and no role in remaining 50%.
Okay, I guess Dr. Shagufta Sheikh has got her answer. There is another question. Is there any relationship between hyperemesis gravidarum with twin gestation and women suffering with migraine? Is there any relationship between hyperemesis gravidarum with twin gestation and women suffering with migraine?
Very good question. But mostly answer is there in my presentation. Okay, I like to repeat. Very good question. So first, hyperemesis gravidarum incidence is more in twin pregnancy. No doubt about that. In twin pregnancy compared to the single tone pregnancy, incidence of hyperemesis gravidarium is more. Why more? Any my PG student can answer, because twin means when simultaneously two fetuses develop in the uterus, that is called as twin pregnancy. So compared to the single tone pregnancy, increase in the hormonal levels are more. So we get the definitely incidence is more in twin pregnancy. And with the migraine, I'm sorry, if patient is suffering from migraine, why? Because she is very sensitive, or her that CTZ vomiting center is very sensitive to these changes occurring. So due to this more sensitive vomiting center of that patient suffering from migraine, we get more incidence of this hyperemesis. What I feel.
Yes, yes, madam. There is another question from Dr. Madhuri Bhalgat. For ketoacidosis, what Shamana Chikitsa shall we prescribe?
For ketoacidosis, what is the Shamana Chikitsa? Question is very good, but one point first I like to tell you, that is for PG students, Shreyas knows so many times I told that in the classes, you should work within our limitations. We should work within our limitation, especially when you are doing obstetrical practice. Oh, I have very good drugs because Shreyas worked on first stage and second stage of labor. Oh, our drugs are very good. This Dhupana Karma has very good result. But if there is contracted pelvis, if there is cephalopelvic disproportion, don't go for the vaginal trial. Though your drug is good, some limitations are there. So if ketoacidosis is there, what I feel, this is my personal view, condition of the patient is definitely serious. Excessive starvation is there, excessive dehydration is there due to vomiting. So I have not used any Shamana Chikitsa if patient is in the acidosis or alkalosis, ketoacidosis. I have not used, because why to take risk? We have a lot of scope to work. So this is my personal view. I must work within my limitation. I never cross my limitation. Within limitation, I should work. So I have not used any Shamana Chikitsa up to this moment for this ketoacidosis.
Yes, madam. We'll take another last two questions.
Okay, Shreyas, no problem.
One question from Dr. Sujita Nair. Ma'am, is it mandatory to check the vitamin B1, etc. levels in of?
Shreyas, you are not audible. Shreyas.
Now, can you hear me, madam? Can you hear me?
No, you are not audible. Please repeat.
Yeah, madam, can you hear me?
Okay, now okay.
Okay. Yes. Dr. Sujita Nair has asked, ma'am, is it mandatory to check the vitamin B1, etc. levels in a case of severe vomiting?
What I feel, because since 30 years I am practicing, and this since 10 years, so many investigation we are doing, or all consultants are doing. So what is my personal view? We know definitely deficiencies are there. So why to waste unnecessary money on the investigation? Because we definitely know, so we can give intramuscularly vitamin supplements or injections. It is my view, because that is very costly. And for report also we should wait. So why to go for investigation? So what is my view for this? In this case, this vitamin levels, it is not necessary to go for investigating vitamin levels. Instead of that, start the vitamins, because we are practicing in developing country. Our India is developing country. If you see the ladies around you, all are suffering from B complex deficiency. Not ladies, gents also. They are suffering from B complex deficiency. So hypervitaminosis never occurs in India. So this is my view. It is not necessary to go for costly investigation and to waste the time for waiting for that report to come. So it is better to start the treatment with B complex C combination of injection intramuscular. It is better.
Okay, madam. Another question by Dr. Smriti Singh from SDM Hassan. Modern drugs used in normal vomiting, but contraindicated in pregnancy.
Please repeat again.
Modern drugs used in normal vomiting, but contraindicated in pregnancy.
Contraindicated or not during pregnancy? La?
Yes, maybe they have just said it like that. I think probably yes, madam.
Huh. So again, what my experience I like to tell. 20 years back, 20 years back, they were advising phenobarbital, Gardena, 30 mg for pregnancy vomiting. Okay. After some time, after 5 years, they removed or they banned that drug. And now phenobarbital is contraindicated during pregnancy. They are telling since 15 years that phenobarbital is contraindicated during pregnancy. Definitely, daily researches they are doing. So mostly they got some bad effects, dangerous effects on the fetus, and they banned that phenobarbital or Gardena because 15 years, 20 years back, routinely they were prescribing this, but after 5 years they banned that medicine. But today, which just I told you, Finargan, Sequil, or Stemitil, we are advising today according to modern sciences. So definitely they are taking the trials and then only they are advising. So today, in practice, which medicines we are advising, these are not having any bad effects on the fetus according to modern sciences. But moreover, that my personal view is we know that first trimester is very delicate in the life of that baby, life of that embryo, because organogenesis is going on in the first trimester of pregnancy. And you know, all drugs taken by pregnant lady through that placenta goes to the baby. So definitely some amount of drug reaches to the baby. So what is my opinion? As far as possible, avoid prescribing or as far as possible, limit your drugs for pregnant lady. Less medicines in first trimester. Just I told you, less medicine. Try to prescribe less medicines in the first trimester. So many things you can do: lifestyle adjustment, food style adjustment, or diet adjustment. With that, one point I forgot to add that after getting up in the morning, pranayama also she can follow. They told that movement of the limbs, move hands, legs, or limb movement. In place of that, you can advise good results. I am advising to my patient pranayama for 5 to 10 minutes, or you can advise deep breathing for the patients, or you can advise Omkar. Om. You can tell her to recite this Om also. So this also gives good result. But again, I like to tell for this answer my question. I'm sorry. I like to tell answer for this question. If possible, less medicines. Today, definitely they are telling no any harmful effect on the fetus. You can use safely. Legally also we can use. But still more what I'd like to tell you, meaning because I am following this, less medicines I am advising. And don't write long prescription, 3, 4, 5, because when you are very interesting thing, when you are passing, you are getting this MS degree, definitely tight collar is there. And from the general practitioner, you are becoming the consultant, gynecologist, and obstetrician. So you feel, oh, I should write long prescription for a doctor who writes so many drugs is very famous. So this is very wrong concept because patients are also becoming aware about the side effect. This is general thing I'm telling, not related with pregnancy vomiting. So patients are also becoming aware about the effect of the medicines on the developing fetus or developing embryo, especially embryo in the first trimester, because media is available from them since 10 to 15 years. All they are having mobile phones in their hand, laptop, they are having education level of the society is increasing, and Google search they can put and get the all information. So when they are coming to you, before that they know everything, they read everything. So now I am telling recurrently to my students, you should become very smart because you are using smart gadgets, and your patients are also very smart. 15 days back we were not having any gadgets, so really patients were innocent. Now patients are coming as your examiners. So many times I am telling to my students, just for 2-3 years we are your examiners, but after getting this MS degree, don't forget each and every patient coming to you is examiner. You test your knowledge.
Yes, madam. Certainly, we are now facing many examiners daily in our practice, which you have told. We are experiencing it, madam. And the last question for today, and we will end the session by Dr. Srinidhi. So, Dr. Srinidhi from SGV Ayurvedic Medical College, Bailora. So, the question is,
you are not
is
audible.
milk advised?
Introduction of that student.
Now can you hear me, madam?
Okay.
Dr. Srinidhi from SGV Ayurvedic Medical College, Bailongal.
Okay.
Is milk advisable during hyperemesis gravidarum? Heard some gynecologists to avoid milk.
Okay. Again, we are Ayurvedic specialists. So many things we should think before advising or not advising. Like Prakriti of the patient, Satmya of the patient, Sattva of the patient. Based on that, if it is tolerable, if she is accepting that milk happily, then you can advise. And how much milk you can advise? Only 1 cup of milk you can advise, because in Chikitsa also, Samanya Chikitsa by Charakacharya, they told the milk also. So milk you can advise, according to my view, you can advise milk, but that direct milk without sugar, it is not acceptable. So Siddha Dugdha you can prepare, or at least you should put in that milk some amount of definitely sugar and cardamom you can add to make it tasty. And 1 cup of milk you can advise. So it is what I feel, it is not contraindicated for all the patients. If good acceptability is there, you can advise.
Okay, thank you, madam. I guess with this, we shall end the session for today. So the Rajiv Gandhi Education Society's Ayurvedic Medical College, Rohan, Karnataka, and also Jignasa, Karnataka, thank you so much for being our guest and enlightening our postgraduate scholars. Thank you, madam.
Thank you, Shreyas, for giving me this wonderful opportunity for expressing my views about this Gharbhini Chardi in this webinar. Thank you, one and all. Thank you.